Parents who are still hesitant about getting their kids vaccinated against coronavirus may be rethinking things now that the contagious Delta variant is spiking weeks before school starts. Dr. Anna Maria Davidson with Memorial Hermann joins me live now. All right, doctor, school starts in less than a month for a lot of kiddos. Is that enough time to get 2 doses and to be considered fully vaccinated?
So we're kind of right up on this timeline. It takes about 5 weeks for the whole process. So 3 weeks in between dose 1 and dose 2. And then we look at 2 weeks out from that second dose to be considered fully immune or have a really robust level of immunity. So we're kind of hitting that mark this coming weekend and into next week. So it's a great time if you are considering getting your kids vaccinated. If you're staff and you work at school, this is a great time to do it so that you can have that immunity built up as we start the school year.
The latest CDC data, as I look at it, shows 0.01% of child cases resulting in death. That's a very small amount. Do you think a lot of parents have not gotten their kids vaccinated because, they see that number and they've heard children aren't affected as much or they aren't spreading it? Are those things true? Because those are things we've heard throughout this pandemic.
Those are good questions and good things to consider. It's definitely more severe in the adult population. The results that we see are the kind of the impact of the illness, the hospitalization, long-term COVID cases, and even death. So children do much better, but they still can contract COVID. They can spread it, and be impacted as well, depending on the health of the child. If they have certain conditions going into it, that can also impact their immunity and ability to fight the illness as well.
And how has the Delta variant, impacted our children?
So we've seen it spreads much faster than the other variants. It's really hitting the population that hasn't been vaccinated, a little bit older than our children, the 18 to kind of 30 range. So your older adolescents and then young adults are who we're seeing mostly impacted in the way of increased hospitalizations and illness there. But still something to consider as you're looking at your kids and their health and we're starting this school year. Vaccines are just a helpful tool for prevention as well.
And so far, doctor, it seems that some school districts have announced preliminary plans about masks, and it seems to be mask optional as of now anyway. Do you still think that kids, especially in elementary or middle school, in that maybe 10 to 12-year age range, should those kids still be masked? Because I'm envisioning here, some parents telling their kids to wear a mask to school, some not, and I just don't see how that's really going to work. And teachers having to police that, it doesn't seem feasible.
You're right. I think there's a lot of questions and challenges the schools are kind of thinking about preparing for. Certainly, CDC has recommended a layered approach. Masking is part of that if you're not vaccinated. But all of these other things that we learned and worked on over this last year to keep kids healthy and staff healthy while they're at school. So cleaning high-touch surfaces, staying home if you're sick, hand hygiene, respiratory etiquette, all of those things are going to be really important, knowing that some folks will be wearing masks and some won't, and we'll have some folks vaccinated and others not vaccinated yet.
All right. Unfortunately, not a normal school year probably yet again, but we're getting closer to it, hopefully. Thank you so much, doctor. Appreciate your time.
Thank you.